Welcome back and thank you. It means the world to me that you're here because, as you'll shortly see, there is now a brand new understanding of what chronic pain actually is and a brand new way to treat it that's generally quite fast, comfortable and permanent, and which does away for the need for medication, equipment or any other treatment that simply hasn't worked for you. So whether you're here because you've got long-term back pain, neck pain, shoulder pain, nerve pain, arthritic pain or fibromyalgia or some other form of persistent pain, I hope you'll very soon feel as excited as I am that we can finally give people relief. Right now, unfortunately, you're one of around 3 million Australians and around 1 billion people worldwide who have not been adequately helped by any medication, who have not seen adequate improvement from any form of physical therapy, and have not been helped by psychologists who have tried to blame their thinking or blame their attitude for their suffering. It's not your fault or your doctor's fault or your physio's fault or your psychologist's fault. The problem is that the field has not yet caught up with the most up-to-date research simply because there is so much resistance to change. Until very recently, the real nature of chronic pain has not been understood. With the benefit of advances in diagnostic technology and the quality of clinical research being done now, we now know without any doubt that in most cases true chronic pain is not triggered anymore by the old injury site or by the old damage. Functional MRI shows us that in almost every case, a mechanism in your brain called a conditioned response is triggering real actual pain signals and often other symptoms as well. Because this same signalling can affect the whole of your central and autonomic nervous systems, you can experience some pretty wild and wacky symptoms, the most bizarre of which are often seen in cases of fibromyalgia. Without exception, chronic pain always starts off as some kind of injury, damage, disease, or trauma, mild or serious. Of course, most people recover very well from these things. They go through an acute phase, which might or might not actually be painful, but they heal up well and they have no pain thereafter. In contrast, about 20% of people unfortunately go on from such an episode to develop chronic pain because their brain has learned to reproduce the pain all on its own as a pattern known as a conditioned response. In some cases, the pain can actually get worse. Normal touch can be perceived as burning or as an electrical shock, and the pain and other symptoms can spread far and wide throughout the entire body. When you appreciate that all this pain and all these other symptoms are because of conditioned activity in the brain, it might also be obvious to you that by switching off the specific brain activity, we switch off the pain as well. We achieve that by identifying your unique pain patterns called stimulus-response bonds and then using multisensory cues to disrupt the reconsolidation phase, breaking the bond and ending the pain. This quickly, very comfortably and permanently reduces and usually totally eliminates your pain. So you won't be needing medication, and you certainly don't need to try to change your attitude or spend months learning to meditate mindfully. You just switch the pain off, much like you'd switch off a light globe. Now, there are two ways that we approach this switching off process, and both are usually crucial. First, we look at your obvious pain patterns and disrupt them permanently. That's reasonably straightforward. The second way is more general. You see, when people have been in pain for a long time, their whole nervous system can become hyper alert and overreactive. Doctors call this central sensitization. The normal stresses of life that most people cope with need to be treated so they no longer trigger that overreaction. Part of this is looking at common complications of chronic pain, like depression, anxiety, sleep dysfunction, and other problems. These issues put even more stress on the nervous system and must also be thoroughly resolved. These two approaches, switching off direct and indirect triggers to your pain patterns, are the reasons we get such an excellent result for the great majority of people. Hearing this, most people plain don't believe it. And I don't blame them, because it's not like anything you've ever experienced or been told before. That's why we always try to find time, even in the very first session, to prove to you how fast and easy it actually is. And that's why so many people walk out of that first session with little or no pain at all. Not everyone, of course, but most. But that's not the end of the story. Almost always there's more work to be done, but it's really important to give you that proof from the get-go if possible, so you can see for yourself that it works. Now, here are some examples of what typical results look like. Sally, not her real name of course, was a 9-year-old who'd been in severe full body pain for many months. She wasn't able to attend school anymore, and every morning her parents had to lift her from her bed to get her to the toilet because she was so weak and in so much pain. She'd actually scream out and cry with pain, even at the touch of their hands on her skin, as gentle as they tried to be. They brought her to me in desperation because nothing had worked, and the next step was going to be following through on a booking they'd already made for a 2-week hospital stay to go on strong medication combined with group therapy using CBT. Sally came into the session with pain she said was 8 out of 10. As you can imagine, she was in considerable distress. At the end of the session, she had no pain at all, 0 pain, and simply reported a slight tingling in the very tips of her fingers that she put at a low 2 out of 10 as a tingle. The next day, Sally went to school and went back to martial arts. She never needed that horrible hospital stay. Now, some of the examples that I'll show you now are from individual clients. 2 of them were on our pilot studies. First is a male, 48, who had full body stiffness that he described as waking up every morning feeling like he was made out of concrete and shooting pains down his arms then and throughout the day. At 2-year follow-up, he reported no more pain at all, the end of being a human statue, and as he said, just a bit of soreness now and then, which for a fairly inactive 50-year-old could be considered fairly normal. This is a female with spina bifida complaining of pain and weakness in her legs. She had more than 50% improvement in both symptoms very quickly, but elected not to continue treatment because she was, for some reason, very happy with that improvement and didn't want to do more. Female with nerve damage in her cervical spine, no more pain at all. Female with back pain due to severe disc degeneration. Her doctor had told her the next step was surgery. Her pain was 8 out of 10, even on medication. But she didn't come because of the pain. She came to me because she'd had to give up her job as a librarian, and she was sad that she couldn't lift up her little granddaughter anymore. We quickly got her pain to sit at 2 to 3 without medication. She went back to work, the job she loved, and reported she could lift her granddaughter with ease. I would have preferred her to keep working with us to get to 0 pain, but like I said, that was enough for her. She was very happy with that. As you can see, a very wide variety of chronic pain can be very quickly reduced and usually eliminated permanently. I've written more cases at the bottom of this page if you want to read about those. Now, there are 3 reasons people might not go ahead and get help. The first is money, of course, and that's exactly why we created the online program in addition to providing individual treatment. It's vital that this help is affordable by everyone, and with chronic pain patients so often unable to work or to work to full capacity, we had a solid commitment regardless of ability to afford therapy sessions. Our online program is accessible 24/7 and even includes personalised support, so you're not going it alone. This can also be the perfect option for those who'd otherwise have to travel overseas or interstate for treatment with us. Now, we have a lot of very fast and easy results, as well as others that take longer, because we also have to deal with stress, anxiety, sleep issues, depression and other problems that can trigger their pain. Nevertheless, some people get the idea that it should work like a magic wand for absolutely everyone. One wave and the pain's gone forever, without any ongoing effort on their part. It's not like that. Working with us to really learn the technique and practicing it for a few minutes of homework a day, well, that's going to get the very best results, the fastest. So yes, it's the fastest, most effective treatment available for chronic pain today, but it's not magic, and we're not going to recommend that you start doing the homework until you and we are confident that you know what you're doing and you're going to get results and not going to feel let down. Finally, and kind of the opposite of thinking it's magic, is the problem of doubt, because it just seems so outrageous to make these claims that people naturally wonder if they're true. This is the major reason that, as I said, we always try to give you proof in the very first session if we can fit it in, so you actually experience your pain decreasing or disappearing in minutes. Before people start on the program, I always like to give a little bit of pre-reading homework so they have a better idea of what to expect and to help with the uncertainty about the unknown. I'll give you a link to that in a moment. Now, obviously, until we've trained more registered health professionals here and overseas in our MDR treatment approach, we have a limit to how many clients we can enrol in the clinic at one time. Just for now, we can only take on 10 new patients every 3 to 6 weeks. That's our limit, depending how many sessions are required. We also need to set time aside to train and support those other health professionals so that they can help more people. And we need to set time aside to give the highest quality support to our online clients as well. If you'd like an individual appointment, I encourage you to request that, obviously without delay, on the link shown here. If you feel the online program fits your circumstances best, the link for that is here also. We don't have a restriction on online enrolments at present, but I assure you we won't take on more clients at the expense of quality care and support. So likewise, if you're sure you want to enrol, do it right away. Now, the pre-reading I mentioned is here. And at the bottom of this page, if you're up to it, is the entire ebook, which you're free to download and distribute to anyone that you think it might help. We simply must get this wonderful advance out there. Whatever you've decided to do, I hope you make a decision to work with us in our mission to make chronic pain history and end this completely unnecessary suffering. Thank you for spending this time with me, and please make the most of it. Bye for now, and let's talk soon.